Hi, this is Dr. David Magnano. I'm a licensed chiropractor in the state of Florida, and I practice in Clearwater, Florida. I am here to talk to you today about sinus conditions. Now, sinus conditions have become very common, especially in Florida, but they are not a normal thing. A lot of people blame the weather for the sinus conditions. The weather can certainly make things worse, but they're not going to be the cause of the problem. If the weather was the cause of the problem, then everybody would have sinus problems. And I know that they're very common, and certainly the weather can make the sinus condition worse, but it's not the cause of the problem. So to tell you how we handle sinus conditions in our office, I just got to give you some fundamentals on how your body works. Basically, the way it works is your brain acts as the master computer, and its job is to tell all the organs, cells, glands, blood vessels, muscles, and joints how to work. And on every day there's some stress, physical, chemical, or emotional stress that will tend to beat up the muscles, the joints, the organs, the glands, the blood vessels. And your brain's job is to take that damage that is done on a daily basis and send repair enzymes to those areas so your body can heal and it can regenerate. If your body does not heal and regenerate, it continually goes downhill until it becomes, a sick body or you have a disease. So the nervous system has a very important role in making sure that these organs, tissues, glands, cells, muscles, joints, all the cells in the body are getting the proper nerve supply, which allows them to regenerate and heal. So how do you run into problems with your sinuses then? Well, the sinuses are controlled by a nerve that comes out of the neck. And I'm going to press this button, which would represent one of the spinal bones, and you can see where the nerve travels, and it goes to the mucous membranes of the nose, the sinuses, in that area. If there's pressure on this nerve, then that part of the body is not going to heal, it's not going to function, it's not going to work as it should, and it will go downhill until it finally becomes a disease situation. Now, they've done lots of studies on this. They actually electronically irritated a nerve that goes to the sinuses, and they watched the mucous membranes of the sinuses swell about 40%. Now that creates a great environment for, obviously mucus, congestion, postnasal drip. It's also a good environment for infection to set in. It's a great breeding ground for somebody to develop an allergy situation. So the other thing that was interesting when they did this study, they electronically irritated the nerve and they watched the mucous membranes of the nose and the sinuses start to swell. When they took the irritation of that nerve away, the sinuses started to heal and recover. So that's very interesting. Now obviously as a chiropractor, and I've been a chiropractor for over 28 years, we've helped many patients with sinus and allergy trouble. We know that when there's irritation on that nerve, those sinuses are not going to work well. And it could be made worse by poor weather. If you have a humid weather, you can have more trouble with that. But that's actually not the cause of the problem. The cause of the problem is actually that part of the body, that organ, gland, tissue, those cells not healing and recovering and working as they should. And there is one system that's responsible for that in the body, and that's the nervous system. So what we do in our office, we do a specialized test. We actually run it up the spine, and it can tell us how the nerves are working in the body. Now I will say, if you look over here on this chart, we put pressure on the nerve at the base of the neck. You can see that that's going to affect the shoulder, arm, and hands. It could cause shoulder, arm, hand pain. It could cause numbness, muscle weakness, frozen shoulder. It can lead to a lot of painful situations. And most people think that all the nerves in the body carry sensation. They really don't. Only about 10% of the nerves in the body feel anything as far as hot, cold, pain, pressure. So 90% of the nerves just carry functions to different areas and organs of the body. The beautiful thing about this test that we do in our office is we can test those nerves that don't necessarily feel pain. And when they're not feeling pain, you don't know that those nerves are shut down until you have a test done. Or if the nerve is shut down and it travels to the sinuses, what will happen is the sinuses will become weaker and weaker and weaker until some condition or disease sets in. So the important thing to understand is by having this test run, we can see how the nerves are working to all the different organs in the body. And therefore, if any of the nerves are shut down, we know that part of the body is breaking down. It's not important whether you have a symptom today or not, But if that part of the body is breaking down, we know a symptom or a disease will develop in that area. Now obviously you may be looking for some solution for your sinus problem. My best recommendation for you is to call our office and come in and have this nerve test done. It can tell us how the nerves are working to the sinuses. It can actually tell us how the nerves are working to other areas as well. But primarily, we can test the areas that are going to the sinuses and let you know if that's the cause of the problem. If that's not the cause of the problem, then of course our treatment will not help. But if that is the cause of the problem, any other treatment you do is not going to actually be working on what's producing the problem. You can medicate the sinuses and make them feel better for a short period of time. There's sprays and prescription drugs and different medications that you can use. But really, in that situation, all you're doing is covering up the symptom. You're just hiding the symptom. You're not actually getting at the cause of the problem. So we do this test in our office. It takes about a half hour from start to finish. The actual test itself takes maybe 10 or 12 minutes. Another important part of this test is you get a readout immediately as to which nerves are not working correctly. Also, it shows us which nerves are working correctly. We can take that readout that we get immediately and just apply that to which nerves travel to which areas and parts of the body and let you know if we can help with that situation. Once again, my name is Dr. David Magnano. I practice in Clearwater, Florida, and thank you for listening.